Are you concerned about your health care with the passage of the recent big, beautiful bill? Hey, I'm Tommy at MedicalInsuranceToday.com. Do a little longer form video here talking about what I know of this bill and what I know about healthcare and what I see coming from our resources, especially through Cover California. So first thing to understand is Medicaid is being talked about. In California, it's known as Medi-Cal. Medicaid and Medi-Cal are the same. In California, it's just its own big system. It's a gigantic system. So to qualify for Medi-Cal is strictly based upon income. Now, Medicare is based on age. That is not being affected, to my understanding, through the big, beautiful bill. I got to get into the finer points with that, but I have not read anything that says that that's going to change, and Medicare is safe at the moment. Medi-Cal is going to change dramatically, and so are some of the plans that you can qualify for through Cover California. But to touch on Medi-Cal directly first. First piece to Medi-Cal is that it is income derived. Everything with Medi-Cal is based upon your income. So if you're below a certain threshold, you get zero cost healthcare, and it's comprehensive. It covers everything: hospitals and surgeries and doctors and prescriptions and emergencies, and a full comprehensive suite of care. Now, if you are not here lawfully, specifically if you are not a citizen, you don't have a green card, don't have a work permit, don't have a visa, you currently, in today's current form, non-lawfully present people qualify for emergency Medi-Cal. So their access to healthcare currently is strictly through the emergency room, emergency Medi-Cal. So they don't get those folks don't qualify for comprehensive zero cost healthcare, but they do get free access through the ER, which is their access point to care in the States. Now that's going to go away. If you are not here lawfully present, access to emergency Medi-Cal is going to disappear and go away. Secondly is the qualification process and income. So in its current form, I hear from people regularly that don't have to provide anything, and they've been on Medi-Cal for years, and they don't have to provide a pay stub or any kind of documentation. I see that in my business on a regular basis. And folks that don't qualify, that make way too much money, are on Medi-Cal. I can guarantee that. I see it on a daily. But the process to qualify is going to grow into, you're going to need to provide a pay stub, W-2, tax filings every year to make sure that you are in fact eligible for Medi-Cal and that your income is below that threshold. It's a federally set number that determines whether or not you get the plan or not. So that is going to increase. They're going to need proof of income. Next I hear is work requirements, which is going to get really gray. Haven't read all the legislature on this and how they're going to qualify it, but for able-bodied folks that are not working or choosing not to work, and obviously we have, there's people out there that choose not to work and are on Medi-Cal. My understanding is that there's going to be requirements to qualify for Medi-Cal. If you're an able-bodied person and not working enough to qualify over the income threshold, you could lose your Medi-Cal as well. And lastly is DACA, deferred action. We call them dreamers in California, folks that are born of non-lawfully present immigrants. So if you're born here in the States of folks not here lawfully, they're defined as DACA recipients or dreamers. My understanding through the law, DACA recipients are no longer going to get benefits through for healthcare or qualify for free Medi-Cal. That is going to change and go away. So those are the main bullet points that we're talking about. So it's really going to tighten up the qualification process. I don't see, from all the news and looking at all sides of the news and trying to remain as neutral as possible to be able to give my consumers and my customers, and to give you accurate information, try and stay neutral on this, is that Medicaid's not really being stripped, and benefits are going to be taken away from folks, but it's only going to be folks that make too much money or they're not here lawfully. And that is my understanding, and the changes that are forthcoming is it's going to be strictly based upon qualifying your income, being more diligent in qualifying the income. And if you're here lawfully, you have a green card, work permit, those benefits are going to remain in place. And if your income qualifies you, your benefits are going to remain in place. So there is a lot of fear out there, and rightly so. There's a lot of change coming, and people don't like change, and people losing their health care is a major issue. I don't want to downplay or down talk that at all. However, the qualification process is going to get much more stringent going forward. Moving to the Affordable Care Act plan. So if you don't get insurance through a job, you typically are going to buy from an agent or directly from Cover California some kind of individual market plan. So as a single person, you have to be over $21,600 of income. And if you're over $21,600 in income annually, Then you're buying a private insurance plan from the same cast of characters that everybody knows: Anthem Blue Cross and Blue Shield and Health Net and Kaiser. And depending upon where you live, that'll determine what you get. Through the passage of the big beautiful bill, what I'm hearing is going to change in the exchange marketplaces. So if you're buying individual insurance yourself, or you're getting it through Cover California, you don't get it at a job, you're self-employed, don't get offered a job or insurance through your work, then you're going to have more stringent income verification, which is, I think, going to be a big focal point. And two, you're going to see a lot less people qualifying for subsidy. So through the pandemic in early 21, legislation passed to fund into these exchanges, as they're called, into Cover California, the exchange, that a lot of folks are qualifying for financial assistance that never did before. So let's say hypothetically your insurance costs $1,000 a month, but you only make $50,000 a year. So that $1,000 a month becomes $200 a month. So you get a big discount, it's known as. It's a federal subsidy. And a lot of the money that was passed in 2021 through the pandemic was helping folks because obviously jobs were sparse and people were in lockdown and a lot of people weren't working. So the government funded into these exchanges a great deal of money to help people qualify for financial assistance to lower their cost of their monthly premiums. That is going away as well. That's expiring. So a lot of people that, my family of four, we qualified into Cover California this year and are qualifying for a subsidy. That's going to go away next year. In 2026, you're going to see healthcare change where a lot of folks are not going to qualify for the subsidies anymore. Those were going to be phased out anyway, but through the big beautiful bill, it's getting highlighted that is going to go away. So all this said, changes are coming. There's no way around it. Change is inevitable, as we all know. What we pride ourselves on is staying ahead of the curve with what's happening in healthcare. So a couple things to take away from this video. One, if you're losing your Medi-Cal and confused about what you can get, our services are free to you as the consumer. I like to tell people we are not the government. My job is to help you figure out your healthcare and give you objective advice as to what's available. And with my state insurance license, that's what I'm available to do, is talk to you about what you qualify for, what you can get, and quote you and run prices, talk to you about plans in detail, and help you find a plan. There is a way, even for non-citizens, to buy healthcare. That does exist. You just can't get subsidized insurance and you can't get Medi-Cal. So there's always a way to get covered. Two, if you are on a Cover California plan or on an exchange-based plan and you are fearful of what's going to happen with your healthcare, number one, your insurance is still safe as we sit here and speak in 2025. In July it is. So going through the rest of this year, your healthcare is safe. During the open enrollment, which comes in October, November, and December, that is the time of year during the open enrollment to measure out what's coming in for 2026. And we're going to know a lot more come October as to what's available and what can be done if you're on a private plan, non-Medi-Cal, and how that is going to play out going forward. We are here to help you. We're here to quote you. Like I said, I'm not the government. My job is to help you find the most affordable and right healthcare for you and your family, and make sure that it's something that you can manage, and that's a decision that only you can make. Prices are going to change, costs are going to go up, everything is, it seems like. So we will be here to help you find the most affordable care that's the right coverage for you, and we do all of that work free of charge. So please get in touch if we can help you. If you're concerned, I hope this video gives you a little bit of comfort that there is a solution for a lot of these problems that are coming forward. There's a way to get insured for nearly everybody. So it's just a matter of what the price is and figuring out exactly the benefits that you can qualify for. So please reach out to us, medicalinsurancetoday.com, and we look forward to serving you.